Who's got their trainers on today? Oh yeah, look at that. Yeah, me as well. Are you allowed to wear trainers to school? Yeah? Oh, and you do? Wow, I like it. I like your style. So go on, show me again. There's lots of people got trainers on. Wow, I'm impressed. So the message is getting out, Hayley. The message is getting out. What's it called? #Active Souls. It's all down to Rachel. Where are you, Rachel? I know she knew I was going to... Rachel put this idea to me when we were talking about how we were going to get some real culture change in Greater Manchester. She said, you know what you should do, Andy? You should make it clear that people have got permission to wear their trainers to work. So I said, oh, okay, that's JD Sports. I'm all in favour of giving them a booster in there. They're a local company, but that's what we said we would do. Make it clear that everyone's got permission to wear their trainers, not just so they can look good at school and all of that, but so they can use them, so they can walk some of the way to school, go for a little run in their lunch hour. And it's amazing, isn't it? It's starting to happen, Hayley, isn't it? This revolution is taking shape. And I think it's a brilliant thing. It's about culture change, isn't it? And that is a real symbol of culture change that we want to see. Make physical activity part of your everyday life. Weave it into your day and get the benefits from being more physically active. But the reason I kind of started with that thing about having permission to prioritise physical activity, I think we've got to kind of take that principle and apply it even further. So I know today in this audience we've got colleagues from the NHS. I'm sure we've got colleagues from our 10 councils, from our schools who I know are here today, community organisations, basically all of Greater Manchester, all walks of life. So rather than just having permission to wear your trainers to work, I want to say to the professionals in the room particularly, I want you to have permission from me to prioritise physical activity and sport in your work. So if you're a doctor, a teacher, a nurse, a social worker, a housing officer, a benefits officer, a support worker of any kind, I want you to know that physical activity is one of the first things you should go to if you're trying to help somebody move forward in their life. You're trying to help them get a sense of control back, get confidence back. Because I think we all know in this room that that's what it does for you. We heard it just then, didn't we? It's not just the physical benefits that it brings, it's the mental benefits. I would say they're bigger. Physical activity is the best mental health policy we have. And it's about time we started using it properly, fully. And that is the big culture change I think we need to see in Greater Manchester. This idea that we've all got permission to prioritise physical activity and sport. And that's why, as Hayley said, we've got to use devolution to put a different principle into practice. Start from the bottom up. Start with people. Start with what people care about. Start with what makes them feel better. Start with what makes them feel happier. Something that brings people together, gives them company, friends, all of those things. That's what we should start with, because you change lives through physical activity and sport. And that is what GM Moving is all about, changing lives, helping people change their own lives, bringing people together so they can support each other to help both move forward in life. And the biggest message I wanted to give you all today is that's the permission I want you to have. And if it helps to have it from me and me saying it, prioritise physical activity in your work. Because I am certain, the evidence is clear, you will help people that you work with to move forward and to succeed. Really proud to say to you this morning that Greater Manchester is becoming more active at a faster rate than the national average. We have increased significantly over the last couple of years since the survey was done. We have improved the number of people physically active by around 1.5%. Doesn't sound a lot, but the national average is 0.5%. So we are improving at a faster rate than the rest of the country, but we need to, because we still have a bigger challenge than some other parts of the country. It's still the case that people from some of our poorer communities are not as active. And we've got to think, why is that? Why are they not as active? If you're thinking about the maximum benefits for society in terms of air quality, in terms of traffic congestion, but actually transport that improves people's health. If you build a road for cars, you might be helping people get from A to B a bit quicker, but you're not improving their health. In fact, you're probably damaging people's health by building a road. If you build cycling and walking provision, you are helping people get from A to B and you are improving their health. So surely it must follow that that is the top thing that you should be funding when it comes to transport infrastructure. And we are. So we're building the B network in Greater Manchester under the amazing guidance of Chris Boardman, who is really making change happen now on the street, on the ground, in all of our communities. What else can we do that builds culture change? I'm really passionate about social prescribing. And I know this is something that the NHS now is really looking at very seriously. I don't think we will have a 21st century NHS until we get to a situation where if people have been to their GP, they are as likely, if not more likely, to leave with a referral for exercise or dietary advice than they are to leave with a prescription for antidepressants or something like that. A 21st century NHS would go straight to the interventions that help people make change in their life rather than just treating a condition that they might have. And that's culture change. You're building it in then to the way we think and work at a local level. And that's what I mean about giving permission to professionals to prioritise physical activity and sport. I'm going to name check Rachel again. It's amazing that the GM, I don't think it's just Rachel who's done this, but the GM cancer team, I don't know if you saw this recently, it's again about changing mindsets, isn't it? If you go back 5 years or 10 years, people would have said to a cancer patient, oh, don't do any just lie down and sit down and take care of yourself and don't go out much. And I'm not sure that is the right advice. In fact, I'm probably certain it's not the right advice. So the GM team have recently been pioneering a scheme called Prehab for cancer, where they're saying as part of your recovery, build in physical activity. I'm really, really amazed and proud that that message is starting to come through. We've got 5Ks for cancer patients happening around the place. That too is an amazing change, and that is part of the culture change that we're all about here today. We're really pleased that the Chief Executive of Sport England is here today, because it's not just about us and what we're doing. We've got a partnership with Sport England at the national level, and because of some of the innovative work that we're doing, they've backed us with £10 million, and they said, look, we want to make Greater Manchester a pilot. Can we think differently about getting people active? So, we've got to show them that they were right to back us. And I think it's really important that we build that partnership with Sport England and make the absolute most of that money that they're putting behind us. And that means you going back to your workplaces and kind of feeling empowered to innovate and to do something different, to break out of the silos that you work in and genuinely prioritise physical activity in your job in a way that perhaps you might not have been able to do before. I'm certain the evidence will support you and I will support you. This is the crucial thing. If you do that, you will not have me saying that was the wrong thing to do. I will always back you all up. I've got your back on this. If you do it, I will support you, because getting people active is getting them on the course to a better life. We want to make this the best place in the country to grow up, to get on, to get old. I know it in my own life. When I'm physically active, I feel like I'm able to do more, do better. We want it to be part of kids' primary school years. We know that if teenagers are doing a bit more, they're probably going to be able to make a successful transition into adulthood. I know that if people are out of work, if you get them active, it's probably the first step to getting back to where they want to be. I know if we want to support older people to have an active life, well, we need to find ways for making sure that they're moving on a daily basis. This is the kind of place that we want to be. And of course, the big thing about physical activity, isn't it? It brings people together.